Good morning, everyone. I am Dr. Richa Par, presenting my paper presentation of liver abscess, recent trend in Ahmedabad. So my aims and objective of this presentation is to study demographic profile, underlying cause, clinical presentation, investigation profile, and management of liver abscess. So analysis of my study shows the most common factor involved in
What's the total number of patients you found?
32 patients
Over a period of?
over a period of 1 year, from November 2022.
1 year, 32 patients.
Most common factor involved in the liver abscess are the cryptogenic, no any underlying cause, which is 75%, followed by undernutrition and enteric fever, which are 18% and 6% respectively. In the clinical manifestation, which is include prolonged fever, which are 5 to 7 days of duration, which is 90%, followed by abdominal pain and vomiting, which is 68% and 25% respectively. In investigation profile, most of the patients are of leukocytosis, which is 62%, and mean hemoglobin, which is 8.6 gram, and moderately anemic. ESR, serum bilirubin, and coagulation profile are within normal limits. Though blood cultures and pus culture are important for the diagnosis of liver abscess, but the positivity rate is only 15% and 12.5% respectively, which shows the patient are partially vaccinated, partially treated previously. And in blood culture and pus culture, there are Staph aureus, Salmonella, and E. coli are the organisms which are important for the causation of liver abscess.
Common in blood and pus culture both?
No.
Same?
In blood culture, there is Staph aureus is common in both blood and pus culture. But in blood culture, Staph aureus, Salmonella, typhi, and E. coli are common. In pus culture, Klebsiella is more common.
Okay.
In ultrasonographic finding, in 40% of the cases, mild hepatomegaly is seen, and right lobe of liver, right lobe, and non-liquefied abscess is more common, and mean size of the abscess is 49 into 40 millimeter. In the treatment modalities of the liver abscess, there is two types: medical and the surgical, conservative and surgical management. In conservative management, antibiotics are 54%, which are treated, and in 43% of the cases, percutaneous needle aspiration. We have the modality of the treatment.
So 50% of liver abscesses you managed without aspiration?
No, in and percutaneous needle aspiration plus antibiotics both are needed in 43%.
Okay. In?
43% of cases.
Okay. And 54% is?
Only antibiotic course of 6 weeks therapy.
That's what. You did not aspirate the liver abscess in 50%?
54% only antibiotics.
Just aspirate, and that's just antibiotics?
4 to 6 weeks of antibiotics.
Okay.
Only 3% of the cases we have done surgical drainage of liver abscess. So the conclusion of my studies is that in developing country like India, due to lower socio-economic class, poor sanitization and hygienicity, pyogenic liver abscess is commonly prevalent in children up to 14 years. In spite of normal laboratory findings, no icterus and negative culture report, one cannot rule out pyogenic liver abscess. Early diagnosis of liver abscess, conservative management, and percutaneous aspiration are mainstay treatment, and these can cause drop in mortality rate, whereas open surgical drainage should be reserved for few selected cases only.
Okay, good. Liver abscess is a liver disease? Then why bilirubin was normal in all patients? You said every patient had a normal bilirubin.
Only 2 out of 32 patients have elevated serum bilirubin.
Agreed. Why that? Why so? A liver disease, I would have expected a high bilirubin. Such big liver abscesses, why bilirubin is normal? Even SGPT was normal, right? Even SGPT was normal.
SGPT
most
and
of the
serum
cases.
bilirubin are...
Despite of being a liver disease, why does liver abscess give you a normal LFT?
Because it is a abscess condition which is leukocytosis count is high, WBC count.
The question is, despite of being a liver condition, why most of the liver abscess patients give you a normal bilirubin SGPT?
Because it cannot alter the structure of liver and...
Okay. There has been a shift, in the sense, in our days, liver abscesses were rare. And suddenly there is a spurge of liver abscesses. What do you think is the reason?
Poor hygiene.
Hygiene was poor since age immemorial. India has never been a good hygienic country. In fact, it is improved.
Lower socioeconomical class is
Poor India since years together. Agreed. Senior to me, such a liver abscess આપણે નતા જોતા, ઓછા જોતા હતા. Very rare. It was very, very rare to diagnose. I'm खुश थे ये liver abscess पकड़ियो. However, the first year picks up liver abscess. I'm tender counts high and it's a liver abscess. Why the shift? Done.